My name is Fatima Satosain, and I'm a postdoctoral fellow at Stanford University working under the supervision of Professor Wu and Professor Sao Halstern. Today, I'm gonna speak about one of my PhD research projects on ultra-small hafnium oxide nanoparticles for the detection of bone microdamages using color spectral CT. This project was supervised by Professor Dipanjan Pan at the University of Illinois Urbana-Champaign. And we carried out these experiments with the help of our collaborators at New Zealand University of Canterbury and also Moss Spectral CT. When we are talking about various imaging modalities, we have to consider that no single imaging modality is appropriate for every application. In fact, the imaging modalities can have different resolution, depth of penetration, speed of acquisition, quantification capabilities, sensitivity, and calcium interference. So one of the workhorse imaging modality in the clinic is computed tomography or CT, where it has an excellent depth of penetration. However, it suffers from poor resolution. It is fast, but it then has a lot of interference from calcium. In order to resolve some of these issues, another imaging modality was spun from this technology that is called a spectral CT, where we are having an enhanced, or we have a competitive depth of penetration. It is fast, but then it doesn't have really calcium interference, and we have an enhanced resolution in this technology. In order to understand how the X-ray signal is being generated, one has to figure out how the X-ray is interacting with the matter. And this also lays the principle for the generation of signal in the spectral CT. Now, imagine that a photon of X-ray is interacting with the matter. Now, this electron might not be really energetic enough, and as a result, it might just go through the material without any deflection in the path and without losing its energy. Another possibility is that the energy will be a little bit higher than the previous scenario. In that case, the photon of X-ray is going to interact with the outer shell electron, and then it's going to scatter the X-ray. The closer is the electron to the nuclei, the possibility for the scattering will be higher, and a lot of energy is being dissipated as a result of the scattering. This phenomena is called the Compton scattering. In the photoelectric effect, what happens is that the energy of the X-ray is so high that it's going to interact with one of the innermost shell electrons that is really close to the nuclei, or the K shell. Then, as a result, one of the outer electrons is going to fill in the vacancy created by this electron. And the energy being dissipated is characteristic of each of the material. And that is called the photoelectric effect. The energy is called the KH energy. And this is the principle for running the color spectral CT. And this graph kind of summarizes what I mentioned in terms of the photon energy and also the relative number of photons being generated. The conventional CT is rather different from the one that is generated in the spectral CT. In the conventional CT, the attenuation occurs mostly as a result of the Compton effect, and indeed it is proportional to the atomic number of the material by the power of the 3. So the higher the atomic number, the higher the attenuation as a result. In the spectral CT, on the other hand, we are relying on the KH of the material. If each of the KHs of the material is being allocated with a color, then we can come up with a colorful image. So let's say we have a contrast agent in the body, and that has a different KH than, let's say, calcium. And these two can be differentiated easily based off of their energy beams, and then will be allocated with a color. And this has been enabled because of the advancement in the spectral CT detectors. On the other hand, since the signal from calcium can be easily suppressed in the spectral CT, we have an enhanced soft tissue contrast, and therefore CT can turn into an MRI. So now here I can give you a flavor of what I mean by colorful images. These are the images which I curated from the Mars Spectral CT catalog and also Philip Icon catalog. And these two companies are actually having the propriety of the device. So here is the phantom of a meat with a bone. Here you can see that how nicely the signal from lipid, calcium, and soft tissue were separated when they were given with a color. And this is an example of an atherosclerosis plaque where the lipid deposition or iron deposition and soft tissue were all separated from one another. This is a clinical case with bone marrow edema where typically in the conventional CT we have a lot of attenuation from the CT signal and we cannot really observe any soft tissue, whereas in the spectral CT where the signal from the calcium is suppressed, the doctor could pick up this abnormality, and that was really competing with MRI signal. And this is a commercial example of a mice being injected with multiple contrast agent materials. So in conclusion, the spectral CT has a reduced radiation dose, and we can get information in nice colors, and we have enhanced soft tissue contrast, improved bone removal. It's a fast technique, of course, it's a CT, and it has a lower metal artifact. Progress in the contrast agent development for spectral CT has also kept up with the ones that is happening in the typical conventional CT. And that is because nanoparticles can give us a lot of opportunities in terms of the diagnosis and therapy that can happen together using one single platform. We can make these particles multifunctional, we can target them and tune their interaction with the biological entities by just tuning their surface charges or the molecular or the surface molecules. Depending on the application, these particles can either be targeted or can be applied systemically. And depending on their sizes, they can just pass through the filters in the kidney, so it is renally clearable, or they can be bigger than 5 nanometers and then get circulated in the body or either be biodegraded or be taken up by the macrophages in the body. So the name Blackpool contrast agents. For our purpose, we use hafnium as contrast agent material for CT imaging and also the spectral CT imaging. And that is because of its high atomic number, which can result in high X-ray attenuation in the conventional CT imaging. In the spectral CT, we need a well-placed KH, and that the optimal KH is dependent on the operating voltage of the tube. Typically, that is between 80 to 140 kVp, and the calculations has demonstrated that the well-placed KH can be anywhere between atomic number of 64 to 73. So that is where the hafnium is falling into. On the other hand, these nanoparticles are safe, and that is the reason behind this that they are under clinical trial as radiosynthesizers for various types of cancer currently in Europe. Finally, they are cost efficient. Imagine that you want to do the whole body imaging using gold nanoparticles. Then you might need as much as 50 grams of gold, which is not really cost efficient. On the other hand, lanthanides might not be a solution because they do not have the potential for industrial scale-up. Depending on the desired outcome, I modified these particles in terms of their composition, making them to be hafnium alone, hafnium oxide, or hafnium disulfide, changing their surface chemistry to tune their interaction with biological entities to make them hydrophilic to hydrophobic, and also playing with their targeting ligand. Finally, I changed the physical properties of these particles, making them of various sizes, ranging from ultra small particles to bigger particles that were hollow, and on the dimensionality, and finally changing the surface roughness of these particles. What I'm gonna focus on today is the ultra small hafnium particles, meaning that the particle size of around 2 to 3 nanometers. In fact, I showed in one of my previous research that we can target the hafnium oxide particle to caries-inducing bacteria in the dental biofilm. And subsequently, we can image these particles using radiographic X-ray imaging. The targeting motif is shown here, which has already been demonstrated to have a high affinity with the Streptococcus mutans, the caries-inducing bacteria. Then, through this example, you can see that first we grew the bacterial biofilm on the surface of the human tooth and did the typical X-ray radiographic imaging that is used in the clinic. And this is the image before any nanoparticle application. After we applied the nanoparticles, washed off the excess of the particles that were bound to the bacterial biofilm is that where the signal is going to be higher and can point to the dental biofilm. And this result was also corroborated by the plaque disclosing agent, as you can appreciate in this uh, graph or image. This work attracted a lot of attention in the news and hit the media. But what we were also curious about was that what other areas these nanoparticles can be useful, and whether these particles can be used as the contrast agent material where the density of calcium is so high, and then can we easily separate the signal from hafnium, not again in the white or black type of image, but rather in color. And that was the impetus for the next part of the presentation, which is actually the topic of the talk today. And the outcome was this paper that appeared on the inside back cover of Advanced Functional Materials in 2020. Bone imaging presents a challenge in the conventional CT imaging, particularly when there is some sort of abnormality associated with it. For instance, in this example, researchers used dual source imaging technology in order to differentiate between osteosarcoma and also the bone signal. Whereas in the conventional CT on D, they could not really separate the signal from these two instances. The same group also looked at the possibility of using negative contrast CT material, that is the generation of gas in situ using nanoparticles, and then try to distinguish the osteosarcoma from the bone using these contrast materials. One area that the abnormalities of the bone actually presents a problem in this imaging is bone microdamages. And essentially, these are small cracks that form as a result of the exposure of bone to constant stresses, fatigue-related cracks, and also other disorders. And if these microdamages go unnoticed, then it might lead to the catastrophic failure of the bone and ultimately fracture. Now, if you have a nanoparticle whose signal can be picked up by some imaging modality and is not obstructed by calcium interference, then we can target these particles to microdamages and use them for imaging these microdamages early on. Now, these particles were synthesized based on hafnium oxide particle, and they were initially functionalized with ethylene amine polymer. Then I surface functionalize them to include this ligand, nitrile triacetic acid, which is basically a calcium chelator. And the rationale behind using this nitrile triacetic acid moiety is that the concentration of freshly cleaved calcium is higher at the site of microdamage compared to the rest of the bone. And therefore, it can accumulate more in the site of the damage. Now, we have previously shown that actually other imaging modalities, such as fluorescent imaging modality, can be used for identifying the bone microdamages. But then we knew back then that this is not clinically translatable. An alternative solution is to use a spectral CT where we can actually suppress the signal from calcium efficiently and see in color the hafnium signal. The large-scale synthesis of hafnium was based on sol-gel chemistry, the particle and hydrous diameter turned out to be only 2 nanometers, so it's like less than 5 nanometers. So sub 5 nanometers particles are really interesting for biological application. At the same time, the success of the carbamide chemistry from the non-targeted particles in order to make targeted nanoparticles turned out to be successful, as confirmed by electrophoretic potential reversal. Other confirmation came from FTIR, where the formation of amide bond was obvious, and also X-ray photoelectron spectroscopy, where again we could understand and show the amide bond formation. But then the question is whether these particles can actually get accumulated at the site of microdamages. In order to test this, I used human bone flanges and then artificially created microdamages with the help of a scalpel. And then immersed this bone sample in the suspension of the nanoparticles, washed off the excess of the particle, and then did a scanning electron microscopy imaging. And here you can see the accumulation of these particles, at least on the walls of the microdamages. And furthermore, we confirmed through the energy dispersive spectroscopy that this is indeed hafnium nanoparticle. Now, ICP analysis also indicated that the amount of hafnium being absorbed for the targeted nanoparticle on the right-hand side is much more than the non-targeted particle on the left-hand side, almost 7-fold higher. Now that we understood that these particles can potentially, at least ex vivo, target the bone microdamages, we moved on to see if these signal from these particles can be picked up by the spectral CT. And here you can see the X-ray attenuation versus hafnium concentration, where a linear correlation was observed in various energy beams. And at the energy beam of the kh of hafnium, which is happening between 65 to 80 keV, we saw an enhancement in the X-ray attenuation as expected. In addition, the phantom studies of iodine, lipid, hafnium, and also air and hydroxyapatite could actually segregate the signal from these entities without much of a problem. Up to here, I hope I convinced you that these particles can bind to the microdamages, but then can they be imaged using the actual bone sample in vitro and also probably in vivo? So here is a micro-CT image of the targeted particle versus the untreated sample and non-targeted particle, where the black and white image actually demonstrates the attenuation of the signal only in the targeted sample. Then we use a spectral CT with the help of our collaborators at Mars Spectral CT. And this is the image of the bone treated with nanoparticles with microdamages. And here you can appreciate how these nanoparticles are being distributed, can give us information about the anatomy of the crack and also the concentration of the hafnium at the site of microdamages. In vivo, we were excited to see whether these materials can have enough contrast enhancement and whether the signal can be picked up by the spectral CT in the colorful way. So in order to test this, I used this model of the bone microdamages in the rat, where we surgically opened up the animal and artificially induced microdamages with the help of a scalpel, sutured back up the animal, and then injected with intramuscularly without nanoparticles. This is the conventional CT image of the non-targeted and targeted injected nanoparticle injected animal, and this is a sham operation. Here you can appreciate that we indeed observe an enhancement in the X-ray attenuation signal as a result of the fact that hafnium is a dense metal. And this is the 3D reconstruction of the similar experiment in the conventional CT. But then the true microdamage site identification came from spectral CT, where not only we could localize the microdamage site appropriately and with precision, but also we could look at the concentration of hafnium accumulated at the microdamage site. These nanoparticles seem to have preserved their particle size distribution once they are injected intramuscularly, and this is the TEM image of the muscle of the injection site. Typically the nanoparticles would undergo aggregation, but we did not really observe any aggregation from these nanoparticles. The H&E staining of the major organs also did not reveal any differences between the control group and the nanoparticle treated group, as was confirmed by a trained histopathologist. Finally, the liver enzymes were not affected in the control and hafnium nanoparticle treatment group, and they were all on the baseline level. So these experiments corroborate the safety of these nanoparticles. I hope I could convey this message that the single source energy CT, which is typically what is in the clinic and is conventional CT, can only give us black and white images. And we are having a hard time when we are encountering abnormalities in a highly calcified region, for instance, bone. Whereas in the Mars spectral CT, the advances in the color detectors has enabled us to distinguish between different materials based on their specific energy beams, and we have enhanced soft tissue contrast as well as getting further information from the highly calcified regions. With this, I would like to extend my acknowledgement to my PhD advisor, Professor Yupanjan Pan, the lab members who helped me with this project, and also our collaborators at Mars Spectral CT. And special thanks to my undergrad mentees who helped me carry out a lot of the experiments. Thanks to my funding agencies, and I would like to conclude my talk today with these 3 take-home messages. And please reach out to me if you have any questions via this email. And thanks for your attention and listening to my talk.